Hi everybody, this is Matteo Guidoni from the lockdown in Burbank, California. While all the 50 states of the US have reported cases of COVID-19, officials said that in the next few weeks we're gonna see a rise of new cases and also deaths. In this difficult situation, medical workers are facing a shortage of PPE, personal protective equipment, in particular face masks. That's why some citizens decided to pitch in producing and donating homemade face masks to their local hospitals, doctors and first responders. The United States is the country hardest hit by COVID-19 and is now in the acceleration phase of the pandemic. A vaccine is not yet available and more than 190,000 people in the country have now been infected by the virus. That's why some citizens decided to offer their help creating and donating their homemade face masks.
I was a nurse practitioner for 20 years, and when I heard that they were running out of all of their supplies, we wanted to make something specifically that we felt would be safe. Certainly the N95s are what everybody needs, but if they can't get them, they can't get them. And we knew of nurses in our area that were told to wear a bandana to work. We produce probably on a daily basis, I'll bet we get about 300 on a daily basis. We've passed out over 7,000 and we're not stopping. We just figure we're just going to keep doing it until nobody needs them.
So here's the mask. I have 5 versions. And so this one right here hangs over your ear, right? And it covers your mouth, and it hooks under your chin. And so you really have a full coverage, so you're not expelling anything, and you're not drawing in anything. So that's how those work. Unfortunately, in my case, I ran out of elastic because everybody's supporting elastic. And so I went to the neighbors, and they've given me supplies. And so I'm now moving my assembly line with all the pieces that I'm preparing to complete the process, and then I'm going to take these over to, in this case, I'm going to take like a dozen over to the hospital close by, and the next batch will go to the fire department, and the next batch will go to the police department. So this way we have our folks that are really on the firing line, if you want, as protected as possible.
I offered the mask on several local groups because I want to create the most impact locally in my neighborhood and beyond. And I have over 100 orders already, and I've just started making them. I think I've made about 10 maybe by now, including the prototypes. And I'm hoping to scale that up and make a little more a day. I have a friend who's a seamstress who's helping me, so she'll churn out a lot of masks as well. I thought I was being proactive. Before people need, I wanted to make the mask, but the need's already there, so we're kind of trying to catch up as fast as we can.
And after talking to all these citizens willing to help their community, we also talked to a woman that is working for one of the most important hospitals of the city of Los Angeles to understand her opinion on these homemade face masks. That's what she told us.
So currently, we're already short face masks. I think the entire country is short. So we have 2, 3, 4 different kinds of masks in hospitals. Kind of the ones that we usually use are the regular little surgical masks that you guys see. They're blue, go around the ears. Those are just they're for droplet precautions, so someone coughing, that kind of thing. The other kind is called an N95 mask, and that's for airborne precautions. Those are the ones that you see, and that they really, really need those in the COVID wards, because when someone is being intubated or they really cough out those particles, they're in the air. So the problem that I have right now is we don't have enough of those masks. They have taken them from us and said, managers lock them up, and if you guys need them, give us a call. So our Central Materials has them, because they need to keep them for the ER nurses, ICU nurses. But if we get a patient that comes in, we have to hang on to our mask and reuse it and just, hope for the best.
What would you say to all these people, organizing, gathering together or not together, virtually together, and producing and then donating those masks?
I feel very, I'm happy, I'm grateful about it. I feel that, their intention is there and they are thinking of us, and I appreciate that. I think that that's so kind. And I think that people want to feel useful. Their jobs and their lives have all come to a halt for the most part, unless they're healthcare workers or are able to work from home. So if they have that talent and they're able to sew and can be of use, that's amazing, and it's so wonderful.
Now the main question is, are those homemade face masks safe? Can they protect us from this violent virus? Well, the answer is complex, because if we should be grateful to all the citizens that are trying to help their community by donating face masks, well, on the other hand, the CDC, the Center for Disease Control and Prevention, warns us that we should do an important distinction.
In settings where face masks are not available, healthcare professionals might use homemade masks for care of patients with COVID-19 as a last resort. However, homemade masks are not considered PPE, personal protective equipment, since their capability to protect healthcare professionals is unknown. Caution should be exercised where considering this option. We thank citizens for their efforts, but it's important to note that this strategy is considered a last resort and does not adhere to the typical standards of care in the US, but acknowledges the hard realities on the ground.
So it is true, in this difficult moment people can still make the difference. And when professional face masks are going to be available again, everybody should try to get some. But until that moment, well, trying to help others and protect ourselves the best way we can, it is the right thing to do. Stay safe.